We will look at perspectives from the international arena, and especially more so specifically in sub-Saharan Africa, where we know, next slide, where we know, despite David having mentioned that IUD use is the commonest used method, in these countries it's actually among the least used methods of modern contraception. Also point out that FP remains a time-sensitive and essential services, even in the context of the ongoing pandemic. And like I said, outside China, the use of the IUD is generally much lower, than other methods. And in fact, when you look at in many countries, especially when you look at in sub-Saharan Africa, the use is generally around 1 to about 3%. A few countries, despite having very well articulate policies and guidelines, there are still some elements of barriers that are non-evidence-based, including restriction for adolescents, not being allowed to use, women who've not had at least one child, women who are not married, or women with multiple partners. And in an assessment of several countries, did find that even though almost 9 out of 10 had policies, 3 out of 4, and 3 out of 4, the IUD is available free of charge in the public sector, you still find difficulties in women accessing it. In terms of also pointing out that access to services, IUD, and of course, generally modern contraception, still remains quite important. And we are beginning to see the private sector being largely unutilized. And in fact, for example, in Kenya, even when you have a IUD use of about 3 to 4% among married women, a lot of this is accessed through the public sector, where 1 out of 3, compared to 3 out of 4 in the private sector, do not provide IUD. And even as you're beginning to see a shift towards modern methods of contraception, and especially the long-acting reversible contraception, a lot of it is actually currently being driven by implants. But you're also beginning to see opportunities, especially through the use of the hormonal IUD being expanded into the public sector, providing an opportunity to catalyze uptake and utilization of IUD, like it was mentioned earlier by David in the US. Next. Next slide. In terms of within the ongoing pandemic, one thing we've seen, of course, there has been a lot of effort in terms of looking and focusing on the pandemic, in terms of spending a lot of energy and effort to minimize spread and also manage cases. But that, and of course, has also resulted in unintended consequences, strained healthcare systems, disruptions in care, resources being redirected, including human resources for health, lockdowns in terms of restrictions of movement, and that has been across the board in many of the countries that we are working in, including shutdown of health services, especially the first few weeks when the coronavirus landed, especially in the region that we are in. Issues of physical distancing and reluctance to go to health facilities, and of course, slowing down of the economy, have also basically also contributed to a reduction in uptake of services. And we do recognize, we have basically recognized the need to maintain provision of essential health services, recognizing the value of contraception, and especially around client-centered care, whereby the client herself determines when to use what method and when to stop using it. And so that has also provides the need for health system to be able to adapt to the burden of the pandemic, and also the health system's baseline capacity. And of course, many countries have come up with a lot of reproductive maternal health, newborn health, evidence-based practical guidelines that really, a lot of them driven by evidence from the other countries where the pandemic landed earlier, organizations and institutions, including the World Health Organization, the International Federation of OBGYN, and others. And of course, for example, like in Kenya, we also had a rapid assessment just to get a sense of how this viral infection, when it's spreading, and it's the disruption to the health service, to what extent it has affected delivery of services. Next. And the other thing is just to point out, of course, we did see initially, again, in the first few weeks of the pandemic in Kenya, a reduction of in family planning of about 30%. And then, of course, we did recognize that the fact that there's need for us to be able to maintain these services. And this includes sufficient and well thought out data counseling at initiation, continuation, and of course, discontinuation. And for whatever reason, for a woman, when she does decide she would like to discontinue that particular method, being able to provide the necessary services, of course, that are also respectful to the fact that we need to minimize infection in either direction, transmission of coronavirus. So again, talking a lot about good quality counseling for continuation, and for whatever reason it is that the woman would considers removal of the IUD, being able to provide additional information related to extension of duration of use, and of course, if there's need for her to remove, then providing those services, like we said, in a way that is safe to both the woman and her providers. I think the other thing we've also been talking a lot about is making sure that then there are opportunities for us to provide those methods across the board, especially in the immediate postpartum period, so that then those who need it are able to access it even as they go home. And of course, that also means means that there's need, of course, for us to talk about side effects and the like. This trend shows basically overall the IUD utilization in the last couple of months between May last year and April this year. And we've seen basically a lot, in terms of the blue graph is about removal. And you do see really a stable sort of numbers, but we do suspect that around March there may have been issues with data. But we do see that we perhaps suspect that going forward we might see a bigger change. But if you look at uptick, you recognize a general gradual decline in uptick. But there are a couple of reasons for that, including availability of some of the method itself. But we also do recognize that from evidence on the long-term effect of an epidemic, for example, in the Ebola virus disease in Western Central Africa, that FD services took perhaps anything between 6 and 24 months to return to the pre-epidemic levels. And so this, again, gives us an opportunity then to be able to think of how to plan enough as you're going through this pandemic, and thinking how do we allow the system to recoil and go back to the initial setting as fast as possible. Next. Again, in terms of IUD and of course the hormonal IUS system, in terms of services, like we keep saying, in many of these countries that we work in, removal is available routinely, usually at the health facilities that provide contraceptive services, and occasionally for the hard-to-reach populations, we would have outreach services, and quite often would link those women to the nearby health facilities. Sometimes that may not necessarily be very near for her to be able to access services for removal as soon as she requires it. So it's also exciting to begin talking about potential for self-removal. I think that also provides a useful opportunity. But during the pandemic, what a couple of things, like we talked about, counseling. Now, this counseling does not have to be in person. A lot of it is using, of course, for us, for the majority of our women, and in Kenya we have a very high mobile phone penetration, is use of the phone, and talk about extended use, treatment of side effects. Like you said, there may be women who may have had it inserted more recently, looking at how we can talk about management of whatever it is. And I think for the hormonal IUS, also looking at it as a tool, a therapeutic tool for women who are bleeding heavily, either from uterine fibroids, those with adenomyosis, and endometrial hyperplasia, and so on and so forth. And I think we still maintain an opportunity for those who require to visit in person, being able to schedule those visits and get removal as necessary. I already mentioned that the fact that in a postpartum period we are providing this, that's also provide an opportunity for us to avail the method even during this pandemic. Next. Just to summarize is, like any other method, IUD removal and of course insertion remain time sensitive and are essential, and of course talk about data counseling and providing other options as necessary, including extension of timing, treating side effects, and removal, of course, as necessary. And I think also again looking at preparing very well and very early for the period after recovery